All right. Good morning, everyone. I think we're going to go ahead and start. It is 11:10, and that is the start time for this panel. So let us go ahead. Healthcare in the United States, it certainly can be a polarizing topic. On one hand, we are certainly experiencing a public health crisis that has demonstrated how the private and public sectors can work together to advance medicine and save lives. But on the other hand, the last 2 years has really shown a spotlight on the cracks in our business as well as our government systems that have fundamentally altered the public's perception of the healthcare industry. This morning, we are going to discuss how various healthcare sectors can work collaboratively towards ending the pandemic, leverage COVID-19 as a catalyst to show a renewed commitment to patient health, as well as discuss strategies for regaining the public's trust. Good morning, everyone. I'm Stephanie Mahin, Clinical Assistant Professor of Management and Corporate Communication here at Kenan-Flagler. Our panelists this morning have spent time in various parts of the public health system at the state, the national, as well as international levels. Each of them is going to begin briefly by introducing themselves, and they'll tell us how their background and their experiences really allow them to provide unique insights about our topic of discussion for today. We are going to start with Adrienne, and then we'll move to Mayra, followed by John.
Okay, sure, great. Good morning, everyone. Thank you, Stephanie. I think we're still in the morning. I'm in Texas, so I know we're just not too far off from you all on the East Coast or from where others are joining virtually. It's really my pleasure to be here with you all today. This topic, it's very intense. There's a lot of different subtopics, and I think it's going to be a great conversation. And honestly, I'm looking forward to learning from the panelists and to learning from all of you with your questions. So I'll just kind of start with that. I think, my background is kind of an interdisciplinary one. I started off in that kind of space in undergrad with international relations and studying foreign cultures. And what I'm going to bring to this conversation today is a lot of the some of the at least foreign or international global health experience. That's where my background has kind of been centered, sort of at the intersection of health and foreign affairs. I've spent a number of years in the State Department with USAID, and my last posting was actually in China with Health and Human Services as the representative there in Beijing from 2016 to 2021, just recently. So, I'm looking forward to sharing my experiences, but the multi-sectoral piece, not just staying within healthcare and talking to business and governments and others, but actually looking beyond health for solutions to health problems or challenges, I think is something that's quite important. It's something that I really learned being part of the PEPFAR program, or the Global HIV President's Emergency Plan for AIDS Relief program many years ago. And I think that tackling the global HIV pandemic really does have a lot of lessons, I think, for how to reach across different lines in societies to solve problems. And so I'll hope to share some of that with you today. And again, just looking forward to learning from you all. Thanks again.
Thanks so much for the opportunity to join you as well. As an alum of UNC School of Public Health, I'm very honored to be part of this panel. So thank you for having me. So a little bit about my background. So I'm showing up in this space today as an advocate. I serve as president of the Children's Partnership. We're a California advocacy organization focused on advancing child health equity. And in our work, we really try and put a children's lens on issues in order to build understanding and hopefully build the tent of support for child well-being, not only in California, but across the country. And we've done this also on the pandemic in order to strengthen, again, the commitment of policymakers around child well-being, and also to hopefully build understanding about how it is that pandemics and other issues of the day, other challenges, impact children uniquely. We've worked on, for example, on strengthening community education and outreach around COVID-19 prevention, treatment, vaccinations, you name it, in order to connect with particularly marginalized communities, such as immigrants or farm worker communities in California, but also strengthening the support that our state can lend towards the rebuild of our communities and support for families, particularly marginalized communities, and the detrimental impact that we know the pandemic has had on their economic well-being, their social well-being, and their overall health. Prior to my role at the Children's Partnership, I've been here, it'll be 6 years on November 30th, but who's counting? Prior to my stint in this nonprofit world, I spent 10 years in Washington, D.C., working on health policy issues. I had the great fortune of serving elected officials. I worked on Capitol Hill for 5 years. I started when then Senator Obama was very junior senator. I was a fellow on Capitol Hill there. I then went and worked on the House side with Congresswoman Hilda Solis. And then the majority of my time was working for Senator Dick Durbin from the state of Illinois. And in that time, really learned about the importance of listening to community members about what their elected officials can do for them, given the importance of public service. So really looking forward to talking about how public trust in government has eroded and what we could do about that. After the 5 years on Capitol Hill, I went and spent 5 years as part of the Obama administration as a political appointee, specifically working on implementation of the Affordable Care Act. I peaked really early in my career. It was the honor of a lifetime to work on the Affordable Care Act because I truly believed in the effort of that law to expand the idea that healthcare is a right and not a privilege. So I'm coming to you in that role as an advocate. So today, professionally, I'm an advocate, but even when I worked on Capitol Hill or I was part of the Obama administration, I wore that hat of an advocate because we're all coming in our professional roles, but we're also coming with our personal experiences. I'm the proud daughter of Mexican immigrants. I grew up in a working class household, and it's those experiences that I think drive my work to ensure that we can have a more equitable system of healthcare, a more equitable system of government that serves every American justly. And I'm hopeful that conversations like this can move us in that direction as we move forward collectively. Thanks.
Great. Good day, everyone. So thanks so much for joining us. It's really a pleasure to be here with this distinguished panel, and I'm glad that you're taking time out of your day to be with us. I just want to also first start out and say thank you to everybody who has been working on the COVID response and your many different organizations. And all of us have been impacted, whether it's in our work or in our personal lives. And it's taking tolls on all of us in some way, shape, or form. And I just want to start out by acknowledging that and appreciating that being here in this moment is an opportunity and a privilege for us to be able to connect. So thanks for all of that. So my name is John Weisman, and I come to this with 30 years of governmental public health experience at the state and local level. So most of my experience was working in 4 local health departments in the United States, 1 in Connecticut, and 3 in Washington state. And so in those jobs, I had a lot of ability and experience to work with city and county council, elected officials around policy issues and community in terms of trying to improve the community's health and the population's health. Most recently, I served as the Washington State Secretary of Health before my current job here at UNC Gillings School of Global Public Health, Mayra. I'm a graduate as well of the school in the DRPH program and now a professor here. As Secretary of Health, I had the opportunity to work with the executive branch and the legislative branch at the state level, and had the opportunity to respond to the nation's first known COVID case at the time. And so spent a year, the first year into the epidemic, working on that. And then I left in January and am now here at Gillings. I started out my career in HIV, which again, I think is great grounding for a lot of us in the work. I will say I was trained as an epidemiologist and didn't really have public policy experience or administrative experience coming out of my master's program. So I have learned sort of about public policy over time and have had the opportunity also to serve as the president of the National Association of County and City Health Officials and of the Association of State and Territorial Health Officials. And the opportunity to work with the federal government, both the administrations during those times, as well as Congress. So I look forward to this conversation with you all, and I'll turn it back over to you, Stephanie.
All right, thank you all so much for introducing us to who you are and the experiences that you bring to this conversation. Because at the heart of our discussion, really what many of you have sort of alluded to is that there's this intersection, right, between government, business, healthcare, public health, and politics. But the sort of the basis of our conversation is that public trust in public health and the healthcare sector has eroded. So we cannot start this conversation without asking the question, in your opinion, how did we get here, right? It's sort of, I know it's a loaded question, a lot of layers to peel back, but where is the fault line? Is this sort of lack of public trust, is it a problem of communication, politics, expertise, outcomes, or is it something else? And John, we'll start with you and go from there.
Sure, thanks. I think fundamentally part of the problem is that our institutions really have failed large segments of our society. And the institutions can be government, it can be public health, it can be the healthcare delivery system, it can be businesses, it can be our political parties that really have failed. I think for too long, whether you are a poor white individual, if you live in rural America, if you're a person of minority race and ethnicity, if you are living with disabilities, gender and sexual orientation minorities, older Americans, many of our institutions have failed these folks. And this has been over many, many years for many, many reasons. And I think folks have been consistently finding a voice. There have been these tipping points, I think, that have really continued to raise the being left out of society, not being heard, not being responded to. So I think, honestly, we all own this, honestly, and we all own the need to find the solutions and to move forward. And I think, you know, as folks, this tipping point has occurred, we also have, so we have these folks rising up and saying, hey, I'm being failed. And you're not listening to me and meeting my everyday needs. And then you now also have people who feel like they have to give something up who are fighting back. And I think this is a very challenging time that we're in. And my view is nobody has to give anything up. We have a lot of resources and we have a lot of things we can bring to the table. So I think this has been happening for quite some time. Then in terms of COVID, I would say that this just became more exacerbated. And in part, it started with a lack of a unified mission from the start. Folks were not unified in exactly what we were needing to accomplish. I don't think many folks sort of understood what the trajectory could be. And frankly, as a public health person who's trained, I had my hard times wrapping my head around the whole of this and just how sort of massive this challenge could be. And I think honestly, it starts with the CEO of the United States not having this clear vision for the United States and the federal government really stepping into lead roles, working well together. And that then just filtered down through all sectors of us. The second piece to the COVID thing, I would say, is this funding imbalance between healthcare and public health and human services is really a problem. And it has led in part to the crumbling of systems that were supposed to respond. And with good people in them who wanted to respond, but were incredibly challenged. And as one of those who was on the front lines, incredibly challenged, there are many stories we could tell. The last thing I would say in terms of COVID, and this gets to also previous, I think, is just our culture. This culture of individualism that we have in the United States, that you just need to pick yourself up by the bootstraps, the sense that America is a land of opportunity for all. It is a land of opportunity, but it is not a land of equal opportunity, in my opinion. And those things, I think, coming together have really sort of led to not a clear mission, not everybody on the same page, systems that weren't there for folks when they needed them, whether you were in a nursing home and you were in a nursing home or you have a loved one in a nursing home, the systems failed you. So that to me leads to a lot of this distrust.
Should we jump in, Stephanie?
Yeah, I was just going to say,
Yeah.
this is going to be a
I want-
free-flowing conversation. So certainly I don't, I'll ask very directed questions, but absolutely jump right in, Adrienne, and then Mayra, if you have something to add to this. Again, very loaded question of how did we get to where we are?
Awesome. Okay, so I was going to say I agree with really all of the points that John made in terms of the fault lines and the systemic issues, right? And the fact that this was COVID, may have started, or SARS-CoV-2 may have started as a virus, right? And as a sort of medical health issue. But I mean, obviously what it's taught us all is that, this had a huge societal impact, and it was sort of the uncovering and targeted all the weaknesses that already existed, right? In our country and in many others, right? We're not in all countries really of the world, right? Everybody's been working on this. I think one thing I would just add, and I'm really interested in too, is sort of these fault lines and sort of what was happening before and what's happening during and after COVID, is sort of how we receive information and what information we trust as a society. This idea, that basically that's it, full stop. Sort of where we get our information, who are our trusted confidants, is my family member that person is the one that is going to influence me as much? Is it my faith community? Is it my friend from college? Is it my colleague? I think that is probably, I hope that we as a society really learn a lot from that, in terms of, we can go out as experts and say, we're the CDC, we're here to help. We used to joke sort of, I'm from the government, I'm here to help. Well, not everybody, has that trust to begin with. I think, as some of the points that John made, right, in terms of the equity issues in our country. And, some people already knew all of this before the pandemic started, but many did not. And it's really shown us, I think, had us look in a mirror and kind of try to reassess what's happening here. But I think the information piece is quite interesting also. So I'll just kind of add that.
The only thing I will add, and I second everything that John and Adrienne have said, absolutely. But I think it's worth emphasizing a point that John made, is really that it may be dangerous to only focus on distrust and only focus on the skepticism that many communities have of our government or of our medical system. Because in doing that, we're really glossing over and not paying attention to the real structural barriers that have limited access to healthcare, access to opportunity for millions, particularly millions of people of color. The historical discrimination faced by Black people and other people of color from the medical system, from the federal government, and frankly, the continuing discrimination and inequities that we know exist, acknowledging that happened, acknowledging that it exists today, and then finding a path to remedy that pain and suffering in order to build, a better community from this pandemic. And in doing so, I think we can really acknowledge those practical barriers that need to be addressed. The failed investments in our community, the lack of pharmacies, the lack of hospitals and providers, the lack of transportation or grocery stores. All of these inequities that are contributing to having the same communities be hardest hit by COVID-19, that were already hard hit by inequities in health prior to the pandemic. So really thinking holistically in our approach is necessary, and also doing some introspection about what has happened in our country in order to move forward again more justly. I just really want to emphasize that point, so that hopefully all of us that are here today can be a part of remedying it for the future.
Well, it's been interesting that there have been a number of organizations to step up in sort of speaking to helping disperse information. My question, as it sort of pertains to some of what you all have alluded to, is what is the role of private businesses in this conversation about public health? Do you expect to see businesses taking a stronger public stance as it pertains to matters related to public health? And if so, is that a good thing? And Mayra, we'll start with you.
So this is Mayra speaking. I do think it's a good thing. I think it matters because, as we've talked about already, we've politicized the issue of health. we've politicized the issue of information and really making sure people have the best information that they have to make the best decisions for their well-being. And I think when you're looking at businesses, they're approaching it from their bottom line perspective. And their bottom line depends on the well-being of their employees, the health of their employees to show up and be able to work on gadgets, be able to deliver products, be able to do the work day in and day out. That has nothing to do with politics. That has to do with health and well-being and ensuring we can show up our best selves in our jobs every day, in our communities, as parents. And I think because of that, you're seeing these businesses really step up and use their voice and power to ensure that their employees are vaccinated, are informed, have access to the time that they need to get those services, because it matters to their business. And I think that really highlights that we are all connected. There is connections between all of us, and thinking about these health issues from that perspective, it's core to us as public health people, right? Like that's who we are. But I think for broad public who may not be aware of that or may not consider that, I think part of this conversation needs to really think, how does my neighbor's well-being influence me? How does the health of my mechanic influence me? We're all connected in that way. And I think for those of us that have been privileged to work from home, we're able to do that, because there are people risking their lives every day on the front line, right? This idea of essential workers are incredible healthcare workers, but it's also our mechanics, our grocery store workers, our food delivery people. These are people that have enabled us, that have the privilege of working from home, to continue to do so. And it's that interconnectedness that builds hopefully empathy and understanding in order to do better about what we can do to mitigate this pandemic and to prevent future ones.
And I see, John, you are nodding your head yes, but before we go to you, I just wanted to provide a little bit of pushback, though, because there are some folks who believe that this is not the role of business. The role of business is not to enforce mandates on vaccines and things of that nature. So, John, what are your thoughts about this question of the role of businesses to sort of take a more public or a stronger public stance?
Well, I would agree with what Mayra said, which is why I was nodding. And I do think it is the role. And it's for the very reason Mayra said. Essentially, if we have this vision of a healthy workforce with healthy families living in thriving communities, which is exactly what business needs, it's what we need in public health. If we can focus on that and say, what are our roles in that space? And the roles, I think, for businesses are to promote policies and systems in their organization that promote health. I worked in an organization, for example, where we instituted an infant at work policy. If you had kids from 6 weeks of age to 6 months of age, and it was a safe work environment, i.e. not in a laboratory where you're not going to take a kid, you could bring your child to work. And this was like supporting what we said, supporting families. Now, ideally, we'd have paid family leave and folks wouldn't necessarily be put in this place of needing to choose, and especially like our younger families who are just starting, who have not accumulated the sick leave, and don't have sort of a cushion of financial resources, right? So businesses need to participate, and they can participate in this starting with their own workplace around their own policies and systems, which is public health. That is public health work. And then they also need to be looking, I think, at the role in larger society. What are those policies that support this healthy workforce in families? And that goes to fiscal policy as well as social policy. And they have to be actively engaged in the community. They need to be at the table with community members, looking at what's best for the community and listening to those folks who want a playground in their area, and like how, if this is where their workers live, how do they help support that? And, and we in government need to say businesses are important, and yes, they need to make a profit, and we understand that and we support that. And so we've got to, bi-directionally really, I think, be engaged in this. Finally, I'd just say, somehow, I think in profit and loss statements and shareholder sort of dividends, folks have to add in somehow the social impacts to the costs here. And we need to, board members, on corporations have to have some honest dialogue and conversation about that.
I may jump in just on that last statement, John, because, one of the, in the midst of this pandemic, I also made a career transition from government, working in government, to working inside a Fortune 500 private corporation, working on diagnostics and the COVID response. And so, but that's been my focus from sort of inside, is to, try to drive these conversations about, that yes, the bottom line is, predominantly what drives a corporation. But I do agree that it also other impact, social impact has to drive it also. Other outcome and other indicators of the work that you're doing. We're active in the global health space. And so there's a lot of equity conversations there around the vaccines, which I think we're going to get into later in this sessions too. But I think it is an important one. And I think you do have to kind of drive it from the outside and also from the inside. So it's an interesting one for sure.
One of the things I do want to do, I think Mayra maybe even mentioned this notion of connectedness. And what I'll try to do is, as our attendees are typing in questions in the Q&A box, I will try to incorporate some of those into our conversation. But one of the questions that popped up is, and this is related to sort of this notion of connectedness and sort of thinking about how US businesses and what their role is, what the public entity's role is in sort of leading a vaccination effort. Let's just even say abroad, particularly when our own sort of domestic rollout has been so difficult. But Lisa asks, what have we learned on what our public health infrastructure should look like going forward? For example, the CDC appeared to be ill-equipped to lead public health policy. Decisions on public health are made at a state, local level versus federal level. The noise level of misinformation, Adrienne, as you talked about on the social media, is unprecedented. So what do you say to that?
Well, I guess I can start in as the one who's worked in governmental public health, one of us, for quite a long time. I think it's absolutely important. We do need some transformation in the public health system. Part of this clearly is that the system's been deteriorating for years for lots of reasons, part of which is sometimes we've lost our focus. Sometimes we have not been that active community partner engaging as we should with business and housing sector and transportation. Like there was this time when we got away from that with the biomedical model. Oh, this is all about sort of medicine. So part of that, we've got some ownership of that. But going forward, we need strong data systems. I can speak firsthand on how weak our data systems were, the inability of my organization to be able to handle the volumes of the data that were coming in and being able to have the systems that actually could handle those. And that wasn't a surprise to us. We knew about that before the pandemic. We'd been looking for funding for, a number of years to upgrade systems. But this is where I think the private sector needs to come, because also now having experienced this, I don't believe that government is as nimble as it needs to be with the changing technology to be able to do the large metadata work that we need to do, the predictive analytics on our own. Simply funding technology to, which is changing so rapidly, takes at least 2 years in a biennium to get a budget passed, not to mention the 3 years of development and implementation. So we've got to work with the private sector. Frankly, the Amazons and Microsoft probably know more about the health of our communities than we do with their large meta. So we've got to figure out how the public and private sector collaborate for the public good, recognizing that isn't necessarily business's role, but it is their role if you think about the healthy society and how we come together. And that this is like one area that just really hampered all of us, even having the right data to know where the hotspots were, right? Like how basic is that? And I just want to say, even though I'm saying that, a shout out to the public health professionals who worked their butts off to respond, and to our healthcare providers and everyone else. So let me just stop there so I can give other folks, time to think about this.
So one thing that I want to jump on, and I just want to say I really appreciate bringing infant to work day, because my 3-month-old is, you might hear them in the background, so I apologize for that. One thing I do want to keep in mind, and this continues this theme of connection. We can't expect our public health system, our healthcare system, to do it all. Right. And this brings to mind, I recently had the honor of serving on the Biden-Harris COVID-19 Health Equity Task Force. And we put forward a set of recommendations for how we can advance health equity in response to COVID-19, but hopefully also in preventing future pandemics. And when the report is public and people read the recommendations, the thing that I am most proud of in that report is that we didn't shy away from the recommendations that really speak to the magnitude of the problems we are facing, right? That it's not just about investing more money in our public health infrastructure, which is absolutely critical and necessary because it's been decimated, but it's also about these other huge challenges that are facing our communities, everything from housing to nutrition supports, broadband access, childcare, that has contributed to these inequities, again, in the COVID-19 response, but also prior to it. So these recommendations are specific in some areas, but also really huge around the initiatives and programs that we have to commit to as a country, as a public, in order to address those health and social inequities that COVID-19 exposed and, as John said before, exacerbated.
So is the this notion of public-private partnership, is this the future of public health, in particularly in non-emergent times, but also in times of crisis? And in addition to that, as you're thinking about a response to that, also consider, will COVID actually change the way government and business interact with one another in a meaningful way? Do you see that happening? Adrienne, what do you think?
Yeah, like any good diplomat, I think the answer is probably, or lawyer, I'd say the answer is it depends. No, but I really do believe that, though, because I think, so to be frank, public-private partnerships and sort of the government and private sector working together has happened in the past in other arenas, right? I mentioned the HIV response that I was part of. That's a good example of not just sort of formal sort of PPPs, but also just the importance of the private sector and the government working together to make, antiretroviral treatment available to the rest of the world when it was only available really in the United States some decades ago, which was really a tragedy. So, I think there are ways to do it. I think, though, that we're going to have to really pay attention to it. It's not going to happen on its own. And I think humans, right, we know from behavioral psychology that humans tend to, revert to their comfort zone and sort of, and humans make up organizations. So unless, sort of the policies change or certain structural issues change, I think, it'll still be challenging to do this. However, I am a stubborn optimist, self-labeled, and I do think that it's possible. But I think that one thing is that companies, private sector, will have to be willing to work in coalition, right? We'll have to be willing to sit at the table with other companies and not stress about, who's gonna get the sale or who's gonna, this is not a, the rebuilding part of this is not a competition, I would put forth, right? That this is going to require coalitions, not just of sort of public health or sort of traditional pharmaceutical, diagnostic, life sciences companies, but other companies, right? We've seen the supply chain horror, right? The things we can learn from, as John mentioned earlier, from Amazon and Google and other companies, or smaller companies even, that maybe we're not, local companies that have thrived. There are some good examples across the United States of, really active local companies that could be involved. So I think businesses will have to, be willing to do that, which I hope that they will. And governments also, are going to have to be flexible in the way that they also engage and be open-minded a little bit more about how governments engage with the business sector, right? Not that, the private sector is just trying to sell them something, but that they have real innovative solutions to these biggest challenges, right? I mean, we have to work together. I just don't think there's a way around it. But I do think it's going to have to take effort and leadership by the government and the private sector, and maybe having sort of a middleman like an academic center or foundations that can help sort of create that safe space where you can build these coalitions. But I think it will require some intentionality. It won't just happen. Those are sort of my initial thoughts about that.
I completely agree with Adrienne that it does require some intentionality. And I also think one of the greatest lessons from the last 18 months is that government can't do it alone, right? It's impossible to do it alone. And in particular, when we're trying to reach many of our most marginalized communities, it's not effective to do it alone. I think some of the most successful vaccination outreach campaigns were not led by the government. They were led by community members themselves. They were led by church groups. They were led by promotoras. They were led by organizations based in the community that have the trust of the community, that speak the language, and made it possible for many community members to get the information they need to make the best decision for themselves, whatever that decision was. And I think keeping that in mind, it allows us to strengthen the future of what public health can look like and what government can look like, and who is representative of that government. Again, keeping in mind that the task force recommendations, really thinking through what are our investments in community organizations? How are we listening to community member voice and leadership in order to be more responsive, more accurate in our response, in order to meaningfully meet the needs of communities where they are? And I think we cannot go back to business as usual, right? Business as usual was not working for millions of people. There were these very stark health inequities prior to COVID-19 that COVID-19 made worse. And I think returning to that status quo is unacceptable. The last 18 months, I think it was amazing to see racial equity, health equity on the television screen, because the numbers were so apparent. You could not ignore how hard hit Black communities, Latino communities, immigrant communities, API communities, Native Americans were because of the pandemic. In rural areas, the idea that we would go back to business as usual is ignoring that, from ignoring the situation of millions of people, and I don't think that it's acceptable, frankly, for people as well as for our government. So this public-private partnerships really gives me a lot of hope for what we could do in the future to advance health equity, and again, to respond to COVID-19 and to prevent future pandemics as well.
I'd agree. And just briefly playing off my two panelists here, it is about leadership, I think, and it's about what brings us together. What common goal do we have? We've already talked about what that common goal is: healthy workforce in thriving communities, which is what we all need. And we've got this opportunity. People have gotten to know each other, right? They were forced to get to know each other, whether you were working clearly together on something or there was a little bit of friction. You wanted some rules changed that you didn't like, but now we know each other, and we've got that responsibility to maintain those relationships, figure out, at least in terms of COVID, after action items that are a priority, and that we start working on those, and that we start working on early wins from those and keep building out from there. And then the last thing I would say is we have got to have our community-based organizations in this as well, and we need to lift them up We need to support our minority-led, minority-serving communities, even when, and fund them in their leadership. And even when it appears that a different organization who might be a big player feels like they can serve more people, the opportunity here is that community-based organization is from the community. They know the community, and we need to support them because they've been there and they haven't been supported.
Adrienne, I wanted to ask you, you brought up this idea about coalition building. What is, drawing from your international experience, what does this look like, this coalition building in terms of, eradication of communicable diseases requiring international collaboration? How do we do some of this coalition building in such a way that, domestically, it seemed like we were falling apart. So how do we internationally make this all happen? And in some instances, domestically, we seem to have been falling apart.
Yeah, so I mean, this is a tough one, and it's not that well, also as the US had challenges, obviously in the domestic space during COVID, we also sort of, I would posit, ceded our leadership in the global fight initially. And I was, on the front lines of that global emergence in China, being in China when this all began. And what I'll say is that, international collaboration and coalition building is not sort of immediate in the time frame, right? These are long-term relationships that have to be built, similar to what we were just talking about in the domestic space, right, with coalitions and communities. So these are long-term relationships, and I think, at times, even though you build those long-term sort of technical relationships between technicians, right, between scientists, and there's a lot of that collaboration happening all the time, I would argue not just on communicable diseases, right? We won't eradicate, we've eradicated smallpox, we're working towards polio, and HIV had a lot of success globally until the pandemic, unfortunately, also. But I think, bringing together governments locally and federally. So there's this idea, I think, when we're working internationally, that we always have to work sort of at the national levels also. And I really actually believe, even in the international space, that state level or provincial level or local community level folks can work together to advance health outcomes that will affect all of us, right? And I think, one of these interesting sort of topics around, should the US, or what does the US leadership look like, in terms of the global vaccination effort? Also, I think, part of it is that I think the US should move more strongly into that space, not because, sort of because when we even had our own challenges, but because of those challenges. I think we have a lot to learn from. We have to put some humility forth, right? I mean, we have a lot to share in terms of, especially the vaccines that were developed with US funding, and there's a lot to share there. But we also have to have some humility and sort of go forward and realize we can learn from what other countries' responses have been, and try to help rebuild sort of this global space, through global organizations like the WHO and the UN system. I think that there are changes there that will likely need to be made in terms of, looking at how these outbreaks occur. But on the trust topic too, I often do think, what if this outbreak had occurred? What if COVID had begun in a country where we had a strong trusting relationship, the US and the country, wherever this X virus came from? And maybe next time it will come from another country where we have a strong trusting relationship. But trust had already been breaking down when this emerged. And so to come back to the core of the public trust, we have to be sort of out there in the world in trusting long-term relationships. And we have to be leaders. And it doesn't mean that we have to finance everything as a government. I don't think that necessarily, but I do think we have to show that we are out in the world trying to advance values of equity and access and these types of things that are important at home. They're important in the United States, and they're important globally, because none of us will be healthy until we're all healthy, right? I mean, it doesn't work that way, right, anymore. We're not isolated. So those are my initial thoughts about that.
I just want to add one thing because I know Adrienne says she's zooming in from Texas.
Yeah.
I'm zooming in from San Diego, California,
Oh,
and the border region was heavily impacted by COVID-19. The closing of the border, this community really depends on the economic activity of the border region, and by closing the borders, it has decimated even more, the livelihood of many families in this region that work across the border or live across the border, and just has really impacted many communities. But it's also contributed to emotional distress, right? For many families that live on both sides of the border, not being able to see your family members as often as you would, the mental health impacts of that. I mean, this pandemic has impacted the mental health of all of us in some way, shape, or form, right? But really thinking through how our international community contributes to the well-being of Americans today is just another factor, particularly for the huge border region of our country as well.
Okay, we are running low on time, but I wanted to try to get in at least one question, one of the three. And so if you answer this in 30 seconds or less, that would be fabulous. But particularly, Mayra, this question, as we're talking about trust and the lack of trust, the erosion of trust, this question from Paul really sort of speaks to how do you suggest that we improve government and private sector cooperation to improve compliance and trust in healthcare, particularly when we talk about underrepresented communities and how there are large numbers of unvaccinated folks in those communities because of lack of trust in the healthcare system. How do we address that?
Okay, in 30 seconds, Stephanie, let me do this. So I think part of it is opening lines of communication. Right. One of the things that we need to keep in mind is that preparing for a pandemic doesn't happen in the middle of a pandemic. Right, we can prepare for the pandemic, the next pandemic now, and making sure that we're taking time to engage in conversations with the private sector and government in order to find out what are shared solutions, what are the unique contributions that the private sector can make and that the government can make. And I think making space and time for that, again, some of those efforts in the federal government to have the space for those conversations were erased, in the prior administration. So how can we continue to have this commitment in order to create that space and do the planning necessary that requires engagement from the private sector and the government sector? I think that's one. And again, you'll see that in the task force recommendations. And I think in general, it's really making space for communication between entities in ways that we haven't before and appreciated. And I think the lesson learned from this pandemic is that it's necessary in order to be more responsive.
Adrienne or John? Okay, all right. So real quickly again, last thing before we run out of time, we have about 2 more minutes. Just final thoughts from each of the panelists. Any advice, wisdom to our attendees, some of whom are students that are soon to take on positions right within the public health sector. What should they be mindful of? How should they be thinking about this time that we're in today and as we try to move forward?
I would start by saying public service is a noble profession. Please give it serious thought, whether that's in government or in a nonprofit sector. And as you prepare yourself for that, be grounded in community, listen, absorb, and hear what people say they need. And if you do that and you join us, we're going to be doing really well.
my advice would be similar. I think, given where we are as a society, I think you can be a public servant, and I agree to be a public servant, and you can do that in many ways. And I think the most important thing is to sort of meet people where they are, right? I mean, whatever entity or sector you're in, to remember that you have a set of views and history and experiences, and other people have equally valuable experience and history and opinions and views. And it's okay if you don't agree, but make some space, as John said, to listen and I think that we can work through all of these challenges, but it will take time. And the other thing is, it will take time. It's not going to be a quarter. It's not going to be a year. It's not going to show up on the financial statements. You know, I mean, it is going to be, this is the long slog, but it is worth it. So I hope that, I look forward to hopefully working with some of you guys someday.
And really quick, the only thing I will say is that, you know, the fight for health justice is intertwined with the fight for immigration justice, with police justice. You know, we do not lead single issue lives, as Audre Lorde said, right? There is no such thing as a single issue struggle because we do not lead single issue lives. So really thinking about how intersectionality plays a role in the well-being of our communities and being committed to learning and working with other sectors is going to be critical to making a difference. So good luck and looking forward to working alongside you.
Right. Thank you so much. We have run out of time. A special thank you to each of our panelists, Adrienne, Parrish, Fuentes, Mayra, Alvarez, and John Weisman, for their time and their insights about public trust in the healthcare sector amid and beyond COVID-19. And thanks to all of our attendees for joining us today. We're going to take a quick break so that you can stretch, maybe get some lunch. But remember that the Dean's Speaker Series keynote with Gina Bartesi, founder and CEO of Kindbody, is going to start in about 15 minutes. So make sure that you join us. Use the Zoom link for that session. It should be in the chat box. Thank you all so much. Have a great day.
Thank you.